Live from the KHOU11 studios, it's Great Day Houston. And now, here's your host, Deborah Duncan.
Good morning, everybody, and welcome to Great Day Houston. Thank you so much. We hope you had a great weekend. For most of us, it's a good time to recharge our batteries, so to speak. But what happens when you never seem to catch up? You feel sluggish even after a good night's sleep, or maybe you can't sleep at all. You're gaining weight, and your skin is changing. Our first guest today says she was struggling to feel and look good from the inside out. She's a recording artist, host of a radio show, Grammy-award winner, and mother. That's right, it is Yolanda Adams. She doesn't have time to slow down, so she turned to a doctor who specializes in helping patients feel and look good by getting to the root of their problems. Please welcome Dr. Shel, author of I Am Woman. She's also the founder of Dr. Shel Medical and Wellness Spa and creator of the Institute of Aesthetics and Wellness, along with her patient, Yolanda Adams. Good morning. All right. Dr. Shel, you know, one of the things I said there is we have to get to the root of the problem.
Absolutely.
And it's about feeling good from the inside out.
Inside out. It really counts how you are feeling on the inside. I can't tell you how many tens of thousands of women out there are struggling, really struggling with fatigue, insomnia, weight gain, exhaustion, irritability, mood swings, depression,
and as you're saying that, Yolanda, your head is bouncing up and down because you're like, yes.
But wait a minute. When I came to Dr. Shel, the first thing she said, well, are you having this? Are you having that? I said, no, I'm fine. I said, but I just, you know, there are just some things that I just can't, you know, I don't understand.
Yeah.
And she's like, no, your cortisol levels are way too high.
Exactly.
You're doing way too much. You're traveling. You're doing. I'm like, but I feel fine because we have convinced ourselves, just like you say all the time. We've convinced ourselves that our life is fine.
Yeah, the show must go on
because we're doing it.
Yeah, the show must go on, and because you're doing it, and while you're doing it, your body is in crisis. Going,
it is.
You know, at some point, if you don't stop, I'm going to stop you.
Right, because we are women. What have we been trained to do?
Yeah,
we have been trained to do
done.
everything for everybody except ourselves sometimes, right?
Yes.
So we are a mother, we're a wife, we're a career woman, we are everything out there, balancing it all except not balancing ourselves because we're the last on the list sometimes, right? So we need to take that time and we need to get ourselves to the point where we deserve to be. Happy, we need to be energized, we need to have an energized body, a peaceful mind, and a joyful spirit.
You know, and one thing you talk about when you say time, we don't have time. And a lot of times what stops us from getting something taken care of is, I don't want to go to one doctor for this, another doctor for that, another doctor for this. So which is the reason why you, as a doctor, were practicing, you saw women coming in with all these similar problems. So you put all of this inside out under one roof.
Under one roof. And so, you know, I had practiced traditional medicine for over 10 years as a board-certified OB-GYN. And so what I realized is women are coming in, I might be looking at their breasts, their pelvis. A cardiologist is looking at this. A GI doctor is looking at that. And women, like you said, don't have time, nor do men. So my goal is, let's find out what's causing all of this. Let's get to the root source of the problem. Let's get to your hormones. Let's balance your estrogen, your progesterone.
So you're starting with the inside, but unfortunately, a lot of us, what we do is we start with the outside.
Yeah, there you go.
Girl, if I look good, then I must be good, right? Yeah. Well, let's talk about some of that stuff, the beautification stuff, which sometimes what brings us in the doors, right?
Sure.
So that outer wellness, as we call it, Coolsculpting, which has been such a great thing to do. Yolanda, like you're tall and thin, okay?
Well, you know, I work out. I have a trainer. I have a chef. I have all that kind of stuff. But there were just some spaces on me that I was like, you know what? I don't like that.
Like, let's pray over this right here.
And then, you know what the other thing was too? I did not want to do surgery.
Right.
You know, because to me, again, with the time factor, I don't have time to sit up somewhere and then recuperate for 12 weeks and things like that. You know, and God bless those of you who do, but I don't. You know, my life is very, very busy.
And sometimes, Dr. Shel, we're talking about spot reducing. Like she's saying, she works out. We work out, but there's parts of our body that might not respond. This is an example of kind of the difference you can make with Coolsculpting. Explain what it is and the fact that you can go back and tweak it if you want to.
So Coolsculpting is a non-invasive, FDA-cleared procedure that targets unwanted fat cells, and it targets those cells. It goes through what's called a cryolipolysis, where it will freeze those cells. Those cells will undergo a natural cell death, and the body will clear it out from your system. So if you have areas, love handles, belly fat, arms, legs, areas of fat that you don't want.
We're going check, check,
all of the
check.
above. you don't want to undergo surgery, a 1-hour procedure in that specific area. Now, of course, everybody's unique. It is not a weight reduction procedure. It is for people who have a healthy lifestyle, like Yolanda said. And we need to just get rid of those spots.
Taking out those spots.
It's taking out those spots, but those fat cells are gone permanently. It's amazing. It's non-invasive. It's FDA approved. They're permanently gone. And we just customize a procedure for each individual depending on what areas they need.
And when do we start noticing the difference?
Immediately.
Oh, wow, really?
Immediately. Well, you know, what, again, like you said, coupled with a healthy lifestyle, this does not take the place of a healthy lifestyle. And what I love about Dr. Shel is she shows you how to eat, what to eat. For me, along with the Coolsculpt and everything that we were doing hormonally, she showed me that I can't eat wheat. I'm not supposed to have peanuts. I'm definitely not supposed to have almonds.
Right. A lot of times we'll eat something and we'll have like a little reaction or something we don't know.
We don't know
but your body is in fight mode.
Because all processes of the body begin in the gut. And so we need to know what foods are there that we're eating, whether it's gluten, yeast, dairy, eggs, things that people eat that really develop this inflammatory response in their bodies, and they feel terrible. They feel like they have headaches and fatigue and, you know, insomnia, brain fog.
So you can do a test to help us figure out.
To actually figure out of the 96 different foods, what is right for you.
Yeah, if food is like medicine, what's the right prescription of food for you?
That's exactly right.
Excellent way to put it, Deborah.
Well, I'm not a doctor, I just play one on TV. But, and then of course, let's go into the bioidentical hormones. That is another area where, you know, a while ago, doctors used to practice. That was real medicine.
That was real medicine.
And then we kind of got away from it. So let's medicate your symptoms. You're depressed, let me give you this. You're this, let me give you this. So we're getting back to, you know, the whole thing of bioidentical hormones, the role that hormones play in the body. And we can say it's part of aging, but we don't have to accept it.
Right, we don't. Because we want to get back to how we felt when we were in our 30s and feeling awesome. So let's get back to that. And the reason we don't feel that anymore is because our progesterone's declining, our testosterone's declining, our DHEA is declining, estrogen. Thyroid is the big one, Deborah, as we all know. Thyroid, when it declines,
one I dealt with,
yes, you dealt with it, I dealt with it, you know, we all have dealt with it because there are millions of people out there that are on antidepressants when they have low thyroid and they've not been diagnosed.
Well, that's what doctors are trying to say to me. That you need to take an antidepressant if you're depressed. You take another medication to help you try to lose weight.
And
we're going to give you another medication to wake you up. Adderall. They have 5 different medications. I was like, really?
No. And replace them all with just balancing your hormones and your thyroid and your cortisol. You're done.
T3, T4, thyroid, mama's back. All right.
There you go.
That's right. All right. So we do the food sensitivity testing, the nutritional testing, and then the bioidentical hormones. All of that affects the way we look on the outside. So the sagging of skin and all that kind of stuff. We talked about Coolsculpting, but Ultherapy is another really neat thing that can avoid surgery but get you the results you want.
So Ultherapy is the only non-invasive procedure that is FDA approved for lifting and tightening of the skin, particularly your face and your neck. So if you are one of those people that is looking in the mirror every day going, I just want a little this and this and this, but I don't want to do surgery, this is the perfect procedure for you because it is using an ultrasound technology. Tried and true. We've had that for decades and decades. It's safe. It uses that technology to stimulate the collagen and elastin in the layer where the plastic surgeons are going to stimulate that. So it's going to that exact layer and pulling everything up. Isn't it awesome?
And it does not make you look like...
Well, yeah, because if you're pulling it tightly, you go, did you have a facelift? You didn't give me that second.
You know?
I didn't have a facelift. Right.
Yeah, because and it's natural. And the reason I wore my scarf today is because I wanted women to see that, you know, it's not...
Here's your face.
It's not like... Oh, she has this happening. No, it's very, very natural. You know, I'm about to be 53 this year.
Woo! So, yes, ma'am.
This under here, I wanted to make sure that that was fine. And after I finished the procedure, I was like, this is so cool. I really am a walking billboard for Dr. Shel because from the bioidentical hormones, my sleep is different. The way my skin texture feels, it's different. And when I came to her, you know, I just had a few things that I wanted to do. Then by the time I finished, I'm like, okay, so how can we get this to the world?
Yeah, absolutely, because it is about feeling good. And again, we realize what's happening in the body, so let's just tweak that and get us back to where we used to be. Hydrafacials is another great...
Hydrafacials are great.
Yeah, right. I love those.
Yolanda, no. It is such an amazing thing to be able to do those. Come into the office, do the hydrofacial, clean out all the toxins from our skin.
Right.
Put in all the antioxidants. We are actually able to infuse our skin with antioxidants during this procedure. Clean it out, get rid of the lymphatic congestion, and get in the antioxidants that we need to really get the skin energized.
I even noticed you, I think, even singing a little differently. You were like, hey, Charles Hughes, yes, I know. You were like all in it.
But let me tell you how safe the Hydrafacial is. My daughter, who's 13, is now on the Hydrafacial.
Which is great if you have, especially at that age of acne and all that stuff that's happening.
Exactly.
Yeah, and men too, the whole bit. All right, and by the way, you do treat men as well.
Absolutely. I think, you know, men are 50% of the population. They too need care. And I will mention, poor men, really. You know, nobody thinks about them sometimes, you know. They have a process in their bodies that they're going through called andropause. Right, which is, women go through menopause, and nobody talks about the men. They're going through andropause, where their testosterone levels are declining significantly, and they are getting tired, they're getting brain fog, they're getting sleeplessness, their libido's going away.
Get your hormones back up, that's your immune system, it helps your heart, it helps your entire body, so it's good for health. But go natural, you know, with the testosterone or the bioidentical hormones. Go with the natural bioidentical hormones that are customized just for you, so you too can get out there feeling energized and joyful and peaceful. All right, thank you very much.
Thank you.
Mark your calendars. Dr. Shel is hosting some open house events. You can learn all about inner and outer wellness, plus get up to $1,500 off Coolsculpting, Ultherapy, or her wellness programs. It all happens this week, Wednesday, April 2nd from 9 to 5, and Thursday, April 3rd from 9 to 7 p.m. You don't have to stay all day. It's just the open house where you can go in, ask questions about what you might need for yourself. For more information, call 281-313-7435, 281-313-7435, or log on to drshel.com.
They can also, Deborah, follow us on Facebook at Dr. Shel, and they'll get all kinds of wonderful free treatment reports and just research and just incredible tips for their health that they can do at home. Yeah. And it would be amazing for them.
The second half of our lives.
Yes,
I'm right behind you. I'm right behind you. All right.
There you go.
Well, how would you like to go to sleep with not so good vision and wake up with 20/20 vision? If you have problems seeing clearly, maybe you should sleep on it. We'll explain next.